Hello, everyone, and welcome to the Babies in Common Show. I'm Jeanette.
And I'm Melissa. Welcome, listeners. Please note that any information shared during the show is not to be taken as medical advice. Please consult your own care providers for questions about you or your baby's health and visit babiesincommon.com/disclaimer to read more.
All right, so today is Saturday, February 20th, and our guest today is Becca Parrish Snowdon, a psychologist who specializes in evaluating children to determine if they'd benefit from additional services at school. And we thought it'd be great to have her come on because we know so many people in our community have toddlers and older kids now too. So I think the oldest child that I would consider part of like the Mothers in Company and Babies in Common community, I want to say is 15.
Oh,
So I
that's
know.
so cool. It's
I
funny
know.
to think about like the first babies I was there for their birth when I was a labor and delivery nurse are now, let's say it was 2007. So they're going to be 14, 13. That's crazy. They're teenagers.
Yeah.
So
Yeah.
I'm very excited about this episode as someone who has 3 young children. And I'm currently homeschooling, not by choice. I'm COVID homeschooling, although I totally support the homeschooling community and have many friends who do. I'm starting to wonder if I need to start looking into something like this for my oldest, some guidance surrounding this topic. So thank you so much for coming on our show, Becca.
Sure. Thank you guys so much for having me.
So I want to tell you a little bit more about Becca. So after receiving her bachelor's degree from Duke in psychology and human development, she worked in a private school for children with special needs and eventually went on to earn her master's degree in school psychology from Northeastern and her PhD in school and counseling psychology. In graduate school, she focused on positive behavior supports for students and assessment of children ages 3 to 21 and did an internship at South Shore Mental Health and a therapeutic collaborative day school, providing outpatient therapy, conducting psychological assessments, and school placement assessments. She did a postdoc fellowship at Mass General Hospital focusing on neuropsychology and assessment and services for children with autism spectrum disorders. And she's currently a school psychologist in the Newton Public Schools, which is a very large school system, specializing in early childhood and autism spectrum disorders and providing assessment, consultation, and therapeutic services for children and families. And we're lucky that we have her living in Central Mass with her 4.5-year-old daughter, who was in our childbirth class, and her 2-year-old son and 5-year-old dog.
Yeah.
I love that you include your dog as like one of your kids there.
Oh, man, he's definitely part of the family, makes himself known. Yeah.
That's
Both
cute.
of my kids are Babies in Common kids for sure, through birth classes and breastfeeding classes and all of the Jeanette support we can get. So I'm happy to be a part of the community and to come back and share what I know.
That's awesome. I agree. Once you're a Babies in Common parent, you're a Babies in Common parent for life. And I feel like even on like one of Jeanette's Facebook group, private Facebook groups, is called Human Milk and Conversation. And it's for anybody that's gone to her support groups. You know, you get added for free if you like. And there are parents in there, moms that have breastfed, haven't breastfed in years, but are still kind of giving support and advice to newer parents. And I just love that part of the Babies in Common community is that, you know, we're all still forming relationships and helping each other out and kind of, you know, creating that village for each other. So
Awesome.
it's nice to meet another Babies in Common family member that I hadn't got a chance to meet.
Yay. And incidentally, in case someone's listening and going, wait, but I'm not in that group, but I think I'm in a group. It used to be called Breast Milk and Conversation, and then we just changed it to Human Milk and Conversation. So
Which I loved. I love that you did that because it includes so many, you know, more people. So.
And I love that you've changed, like, I know that your group format is, are you still doing some virtual groups? Because I know I've sent a few friends your way that probably wouldn't have been able to come to group because they live in Boston or somewhere else. And now they really need the support because they're home and they're isolated. And so I love that. I'm hoping that lots more people will get connected to you that way because it's such a great resource. I know that many of my mom friends I met through Babies in Common group, and it was such an important thing when my babies were young and I had no idea what I was doing.
You're not alone.
Despite having a master's degree in human development and working with children, it's
even
very different.
My toddler will throw a tantrum and I'll look at my husband and I'm like, this is what I do for a living, and I still don't get it right all the time.
It's just different when it's your own kids, man.
It's totally
just different.
So true.
I'm sure he looks over at you and says, yes, doctor, what do we do now?
Yeah.
He backs off. He's like, this is your domain.
No. All right. So you do evaluations for people. You work in a school, and remind me what age group
So
you're
I do
like.
preschool. I work in an
You do
integrated
preschool.
preschool, so age 3 to 5.
Okay. So you don't do up to 21 anymore. That was before.
Yeah.
And now you're doing really, really young. That's your focus.
Yep.
And so I know that when I have talked to friends over the years about getting their kids evaluated, there's this idea of like, well, we have to wait till we're 3, and then talking to not care providers, daycare providers, who are like, well, I'm pretty sure that this is what's going on. And parents who's like, I'm pretty sure that my child is on the spectrum, but they won't do an evaluation. And the teachers aren't allowed to talk about it to the parents. They're not supposed to say, we think your child has this or is
Right.
on this spectrum, or whatever label they would do.
Yeah.
They're not allowed to do that. But then it takes forever to get an evaluation. But what even is an evaluation? Why does it take so long? So can you tell like kind of that process that
Yeah.
help parents who are listening, if they would like to get their child, how do they know if they should have an evaluation? How does that process work? And why does it take so darn long?
Yeah, there's lots of answers to that. And part of it also depends on the age range. So I think first to explain like the different, like who takes care of who. So there's early intervention, and early intervention serves kids who from birth to age 3. And so if you suspect that your child has any type of delay in their early development, whether it's they're not sitting up at 6 or 8 months, or they're not walking when you think they should be, they're not talking, anything like that. Often your pediatrician, when they go through kind of their standard questions, if they are being attentive and catching things, they might suggest that you reach out to early intervention. Also, if your baby was in the NICU or you had a preemie, that's kind of an automatic referral to EI so that you get followed. So that's kind of for the early kids. Early intervention is really the first group that would evaluate them, and they have like a pretty basic evaluation. They used to come to your home. Now it's all virtual, unfortunately, which makes it very challenging. But the for a child, they also are not evaluators who can diagnose a child with autism. So they might say, oh, your child has some speech delays, and their social skills aren't great, and they might and if you're a parent who's savvy enough to kind of read between the lines, you might say like, oh, do you think that they might have an autism spectrum disorder? But they aren't really supposed to say yes or no. So I think a lot of the hesitancy is that people don't want to step out of their lane or their training. So teachers and early intervention providers are not trained diagnosticians. They're not trained psychologists or anyone who can diagnose, or pediatricians who can diagnose an autism spectrum disorder. So they really shouldn't be saying, I think your child's on the spectrum. They can certainly say, I'm observing that your child is, not using as many words as other kids in our class, or something like that. That's an observable behavior. But I think part of it is like, and now with COVID, like so many kids aren't in school, they aren't having what we would consider like typical social interactions, are not having play dates and things like that. So I'm finding that that's very hard to assess children's social skills when they aren't having kind of typical social experiences. But so early intervention is 0 to 3. That's kind of the first age group. Then when kids,
Say one thing about that though.
yeah.
I've also heard from early intervention staff members that parents don't have to wait for a referral from their pediatrician. They can self-refer and ask for that.
And I will often say that I would say most EI referrals are self-referrals. Parents, and I had my own daughter evaluated, self-referred for a speech eval for, she had really persistent ear infections and hearing impairment that led to a speech delay. She did not qualify. So the threshold to qualify, a kid has to be pretty impaired, I would say. They can qualify on clinical judgment if if you're like just at the cutoff and there's enough, history, but you can absolutely self-refer. And unfortunately, I have found, and I'm curious if you agree with this, is that pediatricians tend to miss things.
Yeah.
When we have a great pediatrician, so I'm very grateful, but often I see that kids will go in with their parents, and it's hard. It's a new situation. Like kids are usually not themselves when they go to the pediatrician, and parents can become embarrassed or defensive even if that is the way their kid typically acts. I know my kid can throw a nice tantrum at the pediatrician if scale, or there's a lot of new things, right? But I think sometimes, pediatricians are supposed to be asking a series of developmental questions at those big appointments. So especially like 6 months, 12 months, 18 months, 24 months, there's a lot of questions about typical development. And I know that sometimes the way that they ask those questions don't really give parents a lot of room to share their concerns. So instead of saying like, oh, tell me about what your baby's doing right now, is a much like it's an open-ended way to kind of get that information. Sometimes pediatricians will be more like, your kid's sitting up, yep, they're doing this, yep, and I think a lot of parents are really guarded and defensive and embarrassed if their kid isn't doing what they're supposed to do. And so if you don't have a relationship with your pediatrician where you can ask questions and have a good chunk of time, if you only get 10 minutes for your checkup and they're measuring and weighing and giving a vaccine or whatever, there's not a lot of time for parents to ask those questions or to say like, oh, like she's not really rolling over, or I'm not hearing a lot of sounds, or I have this video of her doing X, Y, and Z. Do you mind watching it? Which is actually a really great thing to do, because then you're in your home environment, and you can show a behavior that you're concerned about. So I think part of it is like pediatricians. If you have a great relationship with your pediatrician and you trust them, they can be a great referral source. But oftentimes it gets missed. And so it takes a little bit longer because parents are unsure and they don't know what to do or how to reach out. And if they don't have a community to ask questions of like, oh, like what should I do? Who do I even call? That can certainly be part of the delay, because something like autism, we can diagnose as early as 18 months, which is pretty rare. I would say most of those cases are kids who have an older sibling who's diagnosed and who are being followed and watched really closely. But certainly by 2.5, 3, it's a pretty reliable diagnosis, and it's fairly easy to, not easy, but it's straightforward to do. But there are many kids who don't get seen until they're 6, 7, once they're actually in school, like in formal school. Does that answer that question?
Yeah. Well, the other part of it was, why does it take so long when you finally want one? Especially like if you have a 3-year-old, right? So you're out of the next step. So with the
so once you turn, so 0 to 3 is early intervention. Once you turn 3, early intervention refers to your public school district. So all of, if you were involved in early intervention, you will get referred to the public school. So a lot of, and my job, a lot of what I do is taking over cases, kids who had early intervention services, and then those get translated into the public preschool. So it becomes special education services. Once you're 3, and let's say you've got a 3.5-year-old and you're in preschool, and maybe you have parent teacher conferences and the teacher says, oh, I'm worried about X, Y, and Z. Then the parents have a couple of choices. They can go to their pediatrician and kind of start that process and see what the pediatrician says and see if they get a referral somewhere. They can go through the public school. Starting at 3, public schools are required to do evaluations if parents request them. And then there's also private evaluations. So I can talk about kind of what the difference between that is. So in the public school, parents can request evaluations, and they cover a series of different areas. So there's speech and language, which obviously looks at their language, and then speech and articulation skills. There's occupational therapy, which looks at kind of school-based functioning of like using your hands, whether at a young age, it's like, can you use your hands functionally to do puzzles and put blocks together? When you get older, it's, can you write your name and do things like that functionally at school? Physical therapy, similar, like can you walk up the stairs and access the playground equipment? A psychological assessment, which is what I do, which is looking at kids' cognitive functioning, looking at their academic achievement, and kind of social, emotional, behavioral functioning, which I'll talk more about kind of what that whole piece looks like. And then a kind of an academic special education, which at preschool is kind of more looking at what did they do? Are they able to access, circle time and all the things that at preschool, are they able to go to the different centers and be successful throughout their day? When, as they get older, it's more like, are they on grade level for their reading benchmark, that type of thing. And public schools are bound by special education law. So there are actually timeframes that have to be adhered to. So once a parent requests an evaluation, the school system has 5 days to respond and give a consent form. Once the parent signs a consent form for the different types of evaluations, The school has 30 school days to complete the evaluations and 45 school days to hold a meeting to discuss the results of the evaluation. So, in terms of school days, 45 school days usually ends up being about 2 months-ish, which feels like a long time, but when you compare it to a private practice, which right now, I know some of the hospitals are running like 9-month plus wait lists.
Wow.
Yeah, so especially right now, they were doing a lot of telehealth assessments, which are challenging, especially for young children. But I think now a lot more are opening up in person. And so private evaluations are done by a variety of different places like hospitals or private practices. They're usually done by psychologists. Some have specific training as being a neuropsychologist, which involves a 2-year kind of postdoc training where you get a lot of supervision and doing all the different types of assessment, and then an extra kind of licensing credential. And those sometimes insurance pays for or pays for part of it. They can be very expensive in the thousands of dollars. Sometimes insurance does not pay or the person doesn't take insurance. So it kind of depends. And they will kind of do kind of a thorough workup of kind of whatever the concern is. So if the concern is a behavioral issue, that's what they'll dive deeply into. If it's an academic concern, like perhaps a reading disability or something like that, or it's more social emotional like anxiety or depression, they'll kind of do a full comprehensive evaluation that looks deeply into that. So those, in addition to having a long wait list, can also then have a long turnaround time. It really depends on the practice and the clinician. Sometimes it can take 6 weeks to get the report, which if your child is older, then you want to share with school because that can help initiate services. And sometimes, usually they will have an appointment with the parents pretty soon after the evaluation to kind of give some general feedback or a diagnosis if there is one. But that written report sometimes can take a really long time to get your hands on, which is really challenging for a lot of families. And that wait list, when you think about like a 9-month wait list for a kid who's 3 years old, it's like almost a third of their life.
Right. Yeah.
Yeah.
And kids change so much in 9 months when they're toddlers. So it's really unfortunate.
And if they're not going to preschool, because not all people do that.
It's not required. Yep.
So the parent would just reach out to the public school themselves directly and say, I'd like you to evaluate my child.
Yep. So a lot of what I do is evaluate. So we have kids in our own kind of the Newton integrated preschool, but we also serve the entire city of Newton. So any child who lives in Newton whose parents, want an evaluation through the school system can do that. And I would say the other difference is that the reason for or the end result of an evaluation through the public school system is to determine if they're eligible for special education services. And that's the state criteria that is set. And it's very specific. Whereas a private evaluation is not necessarily, they're looking to provide the family with data, with perhaps a diagnosis, with referrals and resources. And so the end result in terms of kind of a diagnosis or recommendations can look different.
And I've also understood from friends who've had older kids in elementary school and older too, that certain towns do better with services for kids. And so I have one friend who moved to another town. Like people are literally looking at different towns like, okay, my kids have these needs. Our town's not doing it for them, even though the law requires it. But maybe that town ran out of money, or they're slowing down their services. Who knows? And so they literally will move their whole house to go get those services in another town, which is really a
districts.
commitment.
Yeah, have reputations for having really good or really bad special education services. Yes, that is true. We have a lot in Newton. A lot of people move into Newton with the expectation of getting really good special education services.
Yes, there's a lot of good things that people like about Newton.
That's tough though. I mean, if, we don't have to get into a big conversation about equity but this whole idea that your property taxes pay for your schools is a big problem for kids in a lot of different ways. So that just, speaks to how crazy it is, the system that property taxes pay for school systems, because that leads to a lot of inequity as far as services for, kids around our state and country. And so I'm not surprised that parents are having to sometimes uproot their families to find, services for their kids in need, because not all school districts have the same resources. My husband's a teacher, and he deals with this on a regular basis. It's, as far as the budget and whatnot. So I know it's tough for parents out there. My question is, you mentioned that diagnosing autism can happen potentially as early as 18 months old.
Mhm.
How would you diagnose autism in a pre-verbal child that might not even have a lot of social interaction with kids to begin with? I mean, it's not uncommon for an 18-month-old to not be in daycare. I mean, some
Right.
parents send their kids to daycare, but some don't. So, it's not like they're school aged and have more opportunity to socialize. So what would that look like?
Yeah. So again, I would say kids that young often are, I would say, it's more common that their siblings, they have an older sibling who's on the spectrum. And so they're being watched, pretty closely, because there is a lot of research that shows that there's a higher incidence in siblings. So, but at the same time, often pediatricians will do, it's something called the MChat, which is like a brief questionnaire. I know my pediatrician did it with both of my kids. It's a series of questions that are red flags. I think it starts at age 16 months. I think it goes until like they're 30 months or so. And it asks, because it's not just about language development, although that's part of autism. The other pieces are kind of like social connection, joint attention, eye contact, things like that. So for a parent, they might ask something like, if you point to something on the other side of the room, does your child follow your point? Does your child go to where you're pointing? Are they kind of like with you while you're trying to share your attention with them? They might ask questions like, does your child bring you toys or bring you things to show you and to get your attention? Or how does your child get your attention? They might ask questions about making eye contact. So what does eye contact look like with your baby or your toddler? Do they make eye contact when they're trying to get your attention, trying to get you to do something for them? When they're trying to make, like a vocalization, are they looking at you? Kind of how is the eye contact integrated with their other communication skills? Other things that they might ask about are what is in the diagnostic and statistical manual of diagnosing is restricted and repetitive behaviors. So kids on the autism spectrum often present with some kind of atypical behaviors, whether it's some kids, it's like jumping up and down and kind of flapping their arms, which does not mean that your child has autism. I have a 2-year-old son who, when he gets excited, he jumps up and down and flaps his arms, and I'm pretty sure he doesn't have autism. That's actually like a pretty common thing that kids do at the age of 2, but if they're doing it at like 6 and 7, it can be more atypical. Sometimes kids will take items and like bring them very close to their eyes. It's called visual inspection. Or like with other items, they might like spin them, or things that are really shiny might draw their attention more than others. I think that like the thing with boys, they'll often be very interested in trains, but I feel like all boys are really interested in trains and trucks. So that's like a really tricky one, but it's to the like exclusion of something else, where it's like, even if you had a kid who was on the floor playing with trains, but then you brought out like cupcakes or like a puppy or something like really cool, they would not really be interested in anything else. Or even like your presence. I think part of it is that connectedness too. So kids on the autism spectrum, aren't usually as connected to other people, even their own parents sometimes, or siblings. So even though a young child might not be in daycare or have that social interaction exposure, their interactions with their parents might look different than a typical child. And a lot of times for parents, if it's their first child, they might not know anything different.
Yeah, it's interesting. I've just working as a lactation consultant. I've noticed that sometimes it seems to me that there's some parents who don't want to go there in their mind, even if it's not related to, because I'm not doing the work you do, but even if it's like a feeding issue, right? Or I'm noticing something's going on with a weight gain issue or whatever, like they don't want to go there. And there's those parents who are like, looking for that person to say, yes, I agree with you, even if the parent hasn't said it. Like they're like, oh, I thought something was wrong. I had a gut feeling. I'm glad you said that. Is it the same? I would imagine.
That is, I spend a lot of my days trying to figure out kind of where parents are on that journey of acceptance, basically. And some families, there's a cultural piece to it too. In other countries, autism doesn't exist, or there's not a word for autism. And so Newton is actually a very diverse city. So we have that come up a lot where that's our concern. And then when we talk to the parents, that's just, they're like, oh yeah, his brother's that way and his uncle's that way. That's just, and we're like, oh, okay. But so there's definitely a piece to that where parents might not be ready to hear it yet. And especially with young kids, I think it's really challenging because I think, with that diagnosis piece, we talk a lot, part of my role once I evaluate a child and then I have a long conversation with the parents afterwards if I am making a diagnosis, but then there's like a very long process of them kind of dealing with that information, processing it. How do I tell my family? How do I what do I do differently? What do I need to do next? Who do I call? There's definitely a piece of grief of like grieving over the child they thought that they were going to have and kind of coming to accept this new child, even, though it's the same kid that they have had and have loved, they now see them in a different way. And I think a lot of parents worry about the stigma of, what that label or diagnosis means. I have a lot of parents ask me like, well, is this going to last forever? And like, what do we do next? So that stigma, I think, is a big piece. And I think especially like the idea of special education. I know like when I was younger, that was like a room, like a back room in the school where like kids went and who knows what happened there. It was like a black hole. And it had like a really negative connotation. You don't want to be like that kid. And it looks totally different in school now. I think if our generation of parents were to step into school, you would have no idea which kids were on IEPs and were getting special services and which kids weren't. That's kind of the whole idea. But it's very different than when we were growing up.
So would you say across the state, it's like everybody has integrated classrooms? As far as public schools go, or your typical private school, like, what do you think?
That's usually the goal for kids who can be in an integrated setting and have the benefit of their peers. That's the ideal. There are some kids, like in the program I work in, we have 2 classrooms for kids. They're mostly kids on the autism spectrum. That it's called substantially separate. So it's all kids on the autism spectrum that need individualized support all day long. And they have opportunities to be around kind of typically developing kids when they're able to, but they need a lot of support to get there first. So it really just depends on the level of need that the child has.
And I love you just use the word typical, which I've learned over the last couple of years, that's a word we're supposed to use now, not normal, right?
Right, not normal. Neurotypical, neurodiverse, there's a whole lot of lingo that changes.
I've been trying to learn a lot more about autism too, not only because of members of my own family or friends with children that have received that diagnosis and wanting to be supportive to them, but also just because we're learning so much from like adults with autism, and there's so many great blogs out there, written by adults with autism, and some of the
TV shows about people with autism dating.
Right.
Yeah.
And what's heartbreaking but also inspiring is, many of these adults on the spectrum, didn't get a diagnosis till really late in life. Yeah. And so it sounds like no one person can speak for the entire autism community, and I cannot speak. I am not an autism expert by any means. But it sounds like many of these adults are kind of lamenting their lack of resources and people around them that understood what they were going through and being able to support them. So my question to you is, for a parent that might be struggling with the idea of an autism diagnosis because perhaps they are afraid of their child being labeled, or maybe they're concerned about discrimination, or maybe it's just a scary, thought that because they don't know how life plays out for their child. I can only imagine the amount of emotions that are going on in your head if you're going through this. But what would you like to tell that fictional person that's not sitting right in front of you, as far as the benefits of getting a diagnosis for your child?
Mm.
Um, is there any insight on that?
Yeah, I mean, I think it's such a true point that, when we were kids, the resources for diagnosis and intervention were so sparse. And now, the rates of autism are increasing, but also our ability to diagnose and to treat it is changing too. And the research is so promising that early intervention really helps kids make huge gains. And so when we can start early intervention as early as 3, kids just can make such gains that I think weren't possible because the services weren't there when, the adults that you're speaking of were kids. They were just not understood in a way that I think we have come to understand individuals with autism in kind of a more unique way. So not only is there, there's ABA and there's speech therapy and there's all sorts of services for the children and individuals, but there's also a huge support network for parents. There's lots of local networks, whether it's through kind of your own special education. They have like CPACs or most districts have kind of a parent advisory council or PTO that's just for parents of kids with special needs, which is really cool. So that's a support. And then there's lots of kind of regional groups that offer parent support. And now with, the whole world being virtual, there's an incredible amount of support for people around the country, offering whether it's just like support groups or information about like how to handle behavior at home, things like that. So the resources are infinite and endless, which can sometimes be as scary. That's like, how do you even get started? But they're out there and there's a lot of support. So I think that's, the pro with this kind of the timing of right now. There's lots of options.
To follow up on that, because that's awesome advice. I've heard from some parents that I know there's kind of a controversy in the autism community as far as if certain types of therapy are actually beneficial to children with autism, because it doesn't just accept them for being neurodiverse, it tries to help them be more typical, act more typical, so that they can get along in a world of typical people, typically developing people. And so I hear that as a fear of some parents. Like, I don't want my kid to be in special needs services for autism because he is neurodiverse, and I celebrate that. And I don't want them to like suck the special out of him. It's just a really crude way of me saying this, and I'm oversimplifying it. But any thoughts on that?
Yeah, I mean, I think for me, it always comes down to like, you're their parents. And so like you get to call the shots at the end of the day. I can give you as much research and articles to read and things to arm yourself with information. But at the end of the day, like, that's your choice. If you choose not to accept services and to, not have that, that's fine. I mean, that's your choice. I can tell you that the research shows that services do great things for kids. And I think my thought would be you can have both. You can access services and teach kids some of the skills that will help them be successful in society, because we do have to live in society, but you can also celebrate all of the wonderful, unique things about them. And I think a lot of really good special education programs do that as well. I know in our program, like we have kids who love dance parties. And so we have a lot of dance parties.
I want to go to that school.
Dinosaurs. And so like we use dinosaurs all the time because this kid loves dinosaurs. So there's a way to like utilize that special, unique part of them that you don't have to extinguish it. And so I think that would be my advice, is to try and find a way to marry them together.
I think that's great advice. I like the idea of, kind of doing a little bit of everything and seeing what works best for your family and your child.
Yeah, I love too that now with the integration, I remember my son was in preschool with a child who was very, very quiet, and I think it was just told to us like, oh, he's on the autism spectrum, but it was very, very quiet. And the other kids, because he was so quiet, other kids didn't play with him because they were off doing their own thing, at 3 years old. But for some reason, my son was like really drawn to him. And it was so neat to see but it also made me think like, okay, the kids in the classroom, but like we as older people didn't have, at least in my experience, it sounds like in yours too, like we didn't have lessons on how do you approach somebody? How do you talk to them? How do you handle when someone's doing that? Same thing with somebody in a wheelchair, even who's neurotypical, right? But they're in a wheelchair. Like sometimes we're like, oh, I don't know how to talk to that person. But it's so, I think, do you feel like they're going a little further step now of really trying to help teach kids in the school where you are, for example, of how to interact with everybody else?
I think so. I think it's less about like explicitly teaching it and more about modeling it, which
Sure.
I think goes for parenting too, so that, like you kind of do the same thing you would do with anyone else. Like, hey, do you want to play blocks with me? It's like really the best in. But I think like the message that we try and send is that like everybody, not that everybody's the same, because I think that's doing a disservice. We really try and celebrate that everybody's unique, and that everybody has gifts that they bring to the table, and that they're all different. We're all working on things is a phrase that we hear pretty frequently, like, oh, everybody's working on something different. You're working on, not hitting, and Johnny's working on using his words, and Sophie's working on climbing the stairs. Like we're all working on something different. And so it's just kind of out there. So I think that's, which is true. Like in life, we're all right.
I know. I was gonna say, as adults,
I am a work in progress.
I love that that's just modeled, that like we're all progressing towards something, and that's kind of the language that we use.
I'm actually really impressed. I know all public schools aren't the same and have the same resources, but the school system that my son was most recently in Central Mass, was just your typical suburb, like middle class folks. It wasn't any particularly special top ranking school. But even in kindergarten, they did a lot of growth mindset teaching. That was not something that I learned as a kid. It was like you
explain
were
what that
smart.
is.
So growth mindset, and my husband could talk to you about this all day because he's a
So
teacher,
could I.
but he's a math teacher. So, how some people say, well, I'm just not good at math. That's not a growth mindset. A growth mindset is I'm not good at math yet, but that is a skill that if I practice, I can get good at. And so teaching kids to have a growth mindset that, like, Becca was saying, we're all working on something. And it's not just that I mean, when I was a kid, and I'm sure people even older than me, there was some smart kids, and then there were kids that were not smart, and there were kids that were going to go to college and kids that were going to go into a trade. And it wasn't, everything was very separate. There was honors classes and, level 1, level 2, and level 3, whatever. Right. And that's really kind of putting kids in a box, and so a lot more programs, not just between special ed and not special ed, are integrated, but even things like, middle school and high school math and English, science and history classes are integrated in the fact that kids of all academic abilities, not just special needs versus not special needs, are integrated together. And I think that that's great. And my son, like I said, in kindergarten was learning about growth mindset. And my son in kindergarten, they did a whole big thing during Autism Awareness Month, where, I was very impressed that my 5-year-old would say things like, could recognize different types of perhaps common autistic behaviors, and was taught skills on how to give grace to others, whether they're autistic or not. But like, and he would say things to me, like, just as if it was matter of fact, like if I would go pick him up for school for a dentist appointment, like, oh, that's Charlie. He walks around with a computer because it helps him talk. He doesn't know how to use words like you or me, but we all know how, we all communicate in our own ways. This is my 6-year-old, right? And it wasn't, oh, Johnny gets an iPad and none of us do. Like that wasn't, and it wasn't like Johnny's hidden away from everybody else in this back room in the school, and everybody's very afraid of the special kids because they yell out or they flap or they, hurt themselves, do self-injurious behaviors or whatnot. Those types of things. My son and his classmates saw the counselors or the aides or whatnot working with those kids at lunch, working with those kids at recess, working with those kids in the hallway. And I just think that that's so wonderful. And my kid's school wasn't anything particularly spectacular. And so that gives me a lot of hope that with educators and counselors like you, Becca, that are learning so much more about this, this topic, that our kids are I think we already have evidence that the younger generations are more accepting and tolerant than we ever were taught to be. So,
well, I think school systems in general have really shifted their focus on kind of social emotional learning is kind of the key phrase that they kind of throw around, but at a very early level, like starting in kindergarten, like part of their curriculum, like their general education curriculum, is things like learning about growth mindset, learning basic social skills curriculums on like how do you share, how do you be a good loser, what's a sore loser. So learning those skills that are part of, I think before they were not taught in school, and now they're really being reinforced in school. And so different districts adopt different curriculums, but I think from a district-wide level, it has really become much more visible in schools across the country, certainly in Massachusetts, that, different buildings that I've stepped into, you see their core values. And for the most part,
right.
schools really do work really hard to stand by that and to teach kids like character development and things like that. So I think it's very different than when we went to school. In a really good way in that respect. I mean, kids are in school for like a huge chunk of their day. So it's really important that they're not just learning like math and science and reading, but that they are encouraged to be good humans. So I think
Good
teachers are working really
citizenship,
hard on
good
that.
humans, good friends.
Mhm.
Absolutely. I totally agree. Which is why those of you who know me personally know how much I love Daniel Tiger's Neighborhood.
Love
I do not get paid to endorse the show, but I am obsessed. And for those of you that are new parents out there with maybe pre-TV watching children, check out PBS or the PBS Kids app that you can get on your phone, because Daniel Tiger's Neighborhood is basically a spin-off show of Mr. Rogers' Neighborhood, which is a show that I know we all grew up with.
Mhm.
And it's all about social emotional learning. And the best part is they teach you how to teach social emotional learning to your toddler, to your preschooler through little jingles, which I love
There's a
because I love
song for
singing.
everything.
There's a song for everything. If your friend doesn't want to play with you, you can find something else to do. I got a song for everything.
That's awesome.
I also love Daniel Tiger and all of his friends. Yes, and the jingles are great. We use them all the time. Like if you feel so mad that you want to roar, take a deep breath and count to
Count
four.
to 4.
Mm.
Sometimes mommy has
There's
to remember that one.
Melissa, did you know there's actually research supporting that kids who watch Daniel Tiger have better social emotional skills than kids who do not?
Really? I did not
Wow.
know that,
Yeah,
but now I
somewhere.
love the show even more.
I know, it's research
Wow.
based. Gotta
I'll
love
have to send you the picture of me, Jeanette, and you can maybe put it up on the website with this episode of my husband and I and son dressing up like the Daniel Tiger family for Halloween one year. Because
Yep.
so I'm gonna look into that research, because I totally believe it, because that, I'm sure there are other resources out there besides Daniel Tiger's Neighborhood, but I know that for me, it gave me tools in my parenting toolbox to deal with really common struggles amongst toddlers and preschoolers that, and they're so simple when you watch the show and you're like, oh my gosh, this is such a simple concept, but it's such a big deal to a little kid, right?
Mhm.
What to do when a friend doesn't want to play with you, what to do when you're so mad, what to do when you're sad, what to do, when you're scared, right? There was a whole big episode that was in their Daniel Tiger neighborhood. There was a big hurricane, and it ruined a lot of things in their neighborhood. And it was an episode that was geared towards helping you teach your child about how to deal with natural disasters,
Wow.
right? Like for children that are in hurricanes and floods and whatnot, and, looking for the helpers and things like that. These are such huge emotional concepts that, many parents did not get a lot of social emotional education growing up from their own families, and
Mhm.
struggle even as adults with how to cope with those types of
Right.
things.
And we
So
certainly aren't taught, like, there's no license that you have to get to have kids and to learn how to manage, their big feelings. Toddlers have really big feelings. And I think what I find a lot is that parents think that that's not normal.
right.
That kids having tantrums or throwing stuff or hitting they think that that's bad or not normal. And that's, I mean, that is part of toddler and early childhood development. Kids have big emotions, and they learn how to handle them. And they learn how to handle them by the way parents teach them and model and respond to them. And I think Daniel Tiger does such a good job of helping them. And I agree. I think it teaches parents how to teach their kids to sit down with them and process some of those big feelings. And it does it. I remember when my husband first started watching it with my daughter, and he was like, "This is so repetitive." And I was like, "Yes, that is how kids learn."
Exactly.
It is redundant and then repetitive and then redundant again. And that's how they learn it.
Exactly. Exactly. No, I totally agree because, I can speak personally that, when I was trying to utilize those types of recognizing the big emotion in my child, and instead of, just punishing them for it, trying to get to the root of it and give my kid tools to work through it, whether it's anger or frustration or whatever. If you're feeling frustrated, take a step back and ask for help, right? Where a lot of the adults in my life were like, you're a softie, right? Like your kid just whipped his toy train across. You spank them and send them to their room because they whipped the toy train across the room. But that isn't going to teach them anything about how to deal with the frustration that they couldn't fit the train track together the way they wanted. And we have all been in those situations where we get so frustrated that something isn't working, whether it's something on our computer or something with I don't know, anything. My husband was trying to get a shear pin out of our snowblower the other day, and he threw the wrench, and I don't blame him because it took
Did you
us
sing
like
the song for
hours.
him? Did you sing the song for him?
Well, it also
I
adds a little bit
should've.
of levity, right, Melissa? It's like when a grown-up breaks into song, it also just helps like neutralize the moment and like diffuse it a little bit, because kids are like, "You're singing, but I just threw something."
Right.
And then they're kind of like, "Okay, like we can work together through this." Because you're like,
Yeah.
"It's okay, you're not yelling at me."
It disarms them because they're like,
Yeah.
"What are you doing?"
Yeah.
Yeah. It actually like both fills my heart and breaks my heart when my 4-year-old goes, he'll get really upset and scream. He's so frustrated about something. He's the middle child. So, it's always drama. And he'll be like, "Mommy, help me breathe," and it's like,
Oh,
"Oh God, I know how you feel, buddy." So we
oh,
do
The
our
fact that
big
he
deep
can
breaths together.
articulate that, right?
Right.
Like
And
a
that's
big
part of it
thing.
too, isn't it though? Like teaching typical kids, autistic kids, whatever, the language to tell us how to help them, right?
Mhm.
Because if your kid's just flipping their shit and you're just punishing them for it, like that's a double whammy. Now they're going to feel shame and guilt and also not have the tools to work through that issue, which is going to come up again because life is full of challenges.
Right.
So, being able to say and identify in yourself. I mean, I know grown adults that can identify those types of emotions in their self, right? And there's a lot of vices that people use in their adult life to deal with the fact that they don't have the words to identify how they're feeling.
so back to small children. So it's a pandemic now. Everything's virtual, except occasionally things here and there. How do you feel like all this like homeschooling and on the computer schooling is affecting children? I know parents are voicing concerns. Is there really I know there's a difference between being in school and looking at a screen for school, but being in school with a mask on doesn't give you the facial cues, whereas being on a computer does. It's so interesting, like the when I think about it as a parent, and I'm like, what? There's benefits to both, and is it really gonna, for a year or so, gonna really detrimentally cause a problem to them? It's like, what kind of encouragement, I guess, could you give for both sides of that question?
Yeah, and it's interesting. I feel like my answer in September would have been very different than my answer now at the end of February. And I'll give the caveat that my program is fully in person, so I'm not really I do 2 virtual like groups with our distance learning academy, but most of my work is in person. So I don't have a lot of experience except for from March until June when we were all virtual. So in some ways I've been lucky that we've been in person. But masks are challenging in lots of ways, and that although a lot of our kids use the clear insert smile masks. I should have brought one up because my kids have
Oh,
them.
that's
But
great.
Nice.
I actually might have one. I have one here I can show you. So this is what I wear a lot of the time.
Oh, that's
Oh,
great.
that's
The kids
awesome.
can still see, I mean, it's fogging up right now, so I didn't put the spray on it, but kids can see my mouth, which gives them a little bit more cues to my facial expressions. And so some of our kids will wear those, but most of them just wear the, like the typical disposable masks. I personally feel like virtual school is really challenging across age levels. And I think the more that I've spent a lot of time trying to talk to parents with kids of different ages to try and figure out what their primary struggle is. And what I have learned is that no matter what age your kids are, from like newborn to college age, like young adults, it is really challenging for a variety of reasons. And I think the school piece is a big part of it, for that, elementary through high school piece. Learning on a computer, like we were not meant to sit in front of a computer for 8 hours a day or 6 hours a day or whatever it is. It's not good for our physical body. It's not good for our mental health. It gives kids connections in some ways, but not in the ways that they're really craving. I've heard a lot of kids just say like they miss their friends. They want to be like, they don't want to see their friends on a computer. They want to be with their friends. And so even though they're getting screen time with their friends, it's still really isolating. But I don't know. I feel like this whole year is just going to be like really challenging. And
so really kids should go back to school, and that's really the efforts that are being made. But I think there's certain schools that are doing a better job at getting kids back to school, and there's some parents that don't want that yet.
Totally.
They don't love the screen time for their kids either, but they feel like it's too scary to be in school. But
and I feel like every choice parents are making is like the better of two evils.
Right.
And I know in September, when I was trying to figure out my own work situation and what I was going to do with my own kids, I think my fear was that kids were going to have complexes about we need to wash our hands all the time and we can't get close to people and we can't, teachers are going to be saying keep your space and don't get too close. And I didn't want that to be the message that my kids were getting, that they couldn't get close to their friends or that they couldn't share blocks or whatever. And I think that's not usually the case, especially in preschool. The preschools that I have been in and visited, they look pretty typical, except their numbers are a little bit lower, which is, in my opinion, that's a good thing to, only have 10 kids in a class or 12. And the kids are wearing masks for the most part in most of the preschools, except for the little guys, like the toddlers. But other than that, they have circle time, but they have little mats that they sit on so that they're, intentionally distanced a little bit further than they might be. They might have clear dividers up at their tables when they're having snack or when they're doing an art project or something like that. But I think kids are incredibly resilient, and I'm hopeful that when they look back on this, it will be something that, has given them an opportunity to grow and not something that has scarred them for life. It's my biggest fear, but I don't think
I know. And I think that all parents are in the same boat. That's kind of my hope too, is I'm trying to remain optimistic, because the reality is that children are resilient if we model that resilience and we model good, healthy behaviors and we model optimism. Children are resilient, and no pandemic lasts forever. And I read a story that was very thought-provoking, of a woman who's an adult now in the United States, but I think I don't remember which country it was, which is sad. I want to say it was Serbia, but I'm not sure. But basically, she missed 4 years of school because of the war when she was a kid. And she has her PhD now. And not that everybody is going to grow up to have their PhD. And certainly she had resources that other people don't. But basically, she was just kind of writing this open letter to parents around the world, saying your kids are resilient. They are going to get through this. And we have to stop making, worrying so much about, all the negative things that could all the negative sequelae that could possibly be happening, because there's always going to be some positive to balance it out. And so that's what I keep telling myself.
Yeah, that's such an important part. And I think the more that we as parents can look for those silver linings. I know like at night, sometimes my husband and I will be like, gosh, like we didn't leave the house this weekend. And how cool was it that like we just had like such a slow weekend and we got to like have a leisurely breakfast. And like it's nice if you can model that for your kids. That, like you might not be going to gymnastics or having play dates, but there are things that you get to do with your family, projects that maybe you're doing together, cooking meals together, things that they're learning because they're home. There are silver linings, and finding those I think are really important, and sharing them with your kids is something that's important. The other thing I think that's fun to do is to have things to look forward to. So whether it's like, I can't wait for my daughter, it's like, I can't wait till I can see my grandparents again. That is like, we talk about that all the time. They have not seen their grandparents in a really long time. And but we see them on FaceTime multiple times a day. So that's the other thing, is like, how can you build connection back into your life, back into your kids' lives? And I think that's something that's really important too, is like, how can you have virtual play dates if that's something that your kid wants to do. At first I was like, this sounds ridiculous, I don't know how that's going to work. But the other day we set up an iPad on the kitchen table. My daughter loves to draw, one of her classmates loves to draw. They sat at their respective kitchen tables for 90 minutes drawing each other
Wow.
pictures, and then we put them in the mail and mailed them to each other. And it was
Aw.
the most adorable thing that's ever happened. And so we are setting that up like on a weekly basis, and it's cute. She gets to see her friend. So things like that you just have to get creative. And even if you think it's ridiculous and might not work, my kids often have lunch dates with grandparents, or we've done it with a couple of our neighbors where we just like set up the iPad, put out snacks, and they sit and chat and have a lunch date with somebody. Because even though we can't see them, they want to talk to them. They want to share, like, oh, guess what? Guess what I did in school this week? All of those things. And that way it keeps those connections alive, even though you can't see people, especially in the dead of winter with all the snow, and you can't even like go outside and see your neighbors across the street.
Right.
It's nice to be able to
Yeah.
connect with people. So there are ways that we can use technology that really are supporting our mental health and our connection rather than taking away from it. Like parents, I know you had asked earlier, Jeanette, like, parents taking care of themselves. And I think modeling our own self-care is really important. So whatever it is that brings you joy, whether it's going for a walk or exercising or snuggling with your dog or taking a bubble bath, like you got to do that. And I think it's 100% better if your kids see you do that, because then they are seeing that, you value taking care of yourself, and that's an important thing, and that makes you a better parent. So like I would encourage parents to take out a paper and pencil, make a list of 10, 100, whatever it is, things that bring you joy, and try and do one of them every day. Even simple things like just drinking a hot cup of coffee.
Man, that sounds great, because I
Right?
have to reheat my tea at least 4
having
times
to
in
put
the
it
morning.
Whatever it may be, I think. And then reflecting on the fact, like, yes, I did do something today that brought me joy. Because I think it's easy to get in the weeds of like, gosh, like this is so hard and this is so long and it feels like there's no end in sight. And we've been doing this for almost a year. That if you can stop and say like, okay, today I did get to do X, Y, or Z, or today I know that I'm going to make time for myself to go for a walk, or to call that friend that I've been meaning to return her voicemail for however many months. I think it's important for us to keep our social connections, to keep our self-care a priority, because kids, especially, I think like the 0 to 4 or 5, they are so connected with our emotions, way more than I think the older kids. Like they know if we are stressed. I remember, Jenna, I think it was in one of your classes, we were talking about like babies. It was in one of the breastfeeding groups, and we were talking about babies crying and how like baby's crying at night and you get so worked up and like the baby doesn't settle, and like that has stuck with me through years and years of parenting. And so when my kids are upset, the first thing that I do is check in with myself and take a few deep breaths and calm myself down. And not only does that model for my kids, like, all right, that's what mom does, but it's also like they are so in tune with that. And so the moment I start to settle down, then they are in a place where they can start to settle down. And so if you are, we're all like, our anxiety is like a 10 out of 10 most days right now, right? So like if that's what your kids see, then I think it's not to be a surprise that our kids are going to be anxious and stressed, and we're going to see things come out in them. So not to say that we should hide our anxiety, but that we should model different ways that we take care of ourselves that's healthy, that's not detrimental to our health or mental health.
I heard something today from some, I won't say who it is, but like some vlogger that I watch once in a while who's got small children. And she was just like talking about how she's not going to make any plans. She's tired of making plans because nothing's working out. And I was just like, okay, yeah, in 2020, plans didn't work out, but it still can be a healthy, fun activity to plan a vacation or plan, here are the 30 people that we're going to make dates with once this is over, so that, yeah, maybe it won't happen that your vacation happens in August, but then maybe it could happen the next summer. And at least you've sat there and you've looked on the internet and you've kind of figured out where you're going to go, or you've talked to your kids about what activities they might want to do. So it fills the time, but it gives you something hopeful to look for. Even if it's what parks do you want to go to, or what museums should we go to next summer? Like, it doesn't have to be a vacation. But I think even with small children, like, what puzzle do you want to do next? Or can you think of something, like creating those ideas to plan ahead? Because I feel like people are giving up on plans.
Yeah. And I think that there can be short-term things to look forward to and long-term things to look forward to. So, there can be things that are going to happen. I'm excited to, go pick flowers or to watch our tulips come up in the front yard. And then long-term things like I can't wait to get on an airplane and go on a vacation, which I don't like planes. I never thought I would say that, but somewhere that requires airplane, but it could be like a couple years until I'm comfortable doing that. Who knows? But I agree. I think it's important to have things to look forward to.
My son has a running list of all the trampoline parks that he's going to jump at when the pandemic is over. So I think that's a great way to end our show on that positive note of that there's, find that something to take care of yourself, find that something to look forward to, make looking forward to something in the short term or long term a family activity. And I think that's wonderful. This has been such a great conversation today, Becca. Thank you so much for coming on our show.
Absolutely. Thank you for having me. It's been fun.
Oh, awesome. Well, we hope you enjoyed today's show. And if you have questions for Becca, not necessarily specifically about your child, of course, but maybe just about the process, we can pass them along to her. We hope you'll tune in again to our show. And remember, Babies in Common is a community for you. After all, we all have babies in common.
Thank you, everyone.